Hey everyone! Wow, we find ourselves in week 4. Week 4, we're going to talk about the medications that we give that are antiemetics. What are antiemetics, you might ask? Those are medications that will help prevent nausea and vomiting. Um, I'll be honest, I don't love being around vomit. I can deal with it. I've dealt with it my whole career. But if I had to vote, I'd vote not to. So if I can keep someone from being nauseous and vomiting, I'm going to do so. Uh, we're going to talk about several medications. Some of them you will be very familiar with. Some of them you will probably have never heard of. And that's okay. Some of these medications aren't carried on the ambulances. Some of these medications are not really given much anymore because they're older medications. But we do need to learn about them and learn the basic information about them and the risks associated with those different medications. So the first medication we're going to talk about is Reglan. Reglan is the trade name for a medication. I got to use my cheat sheet here. It's metoclopramide is the generic name for it, and it is a medication that is given for patients that have issues with GERD. It reduces stomach acid in the stomach, so hopefully reducing heartburn, therefore reducing nausea and vomiting. We don't really give it much in the ambulance, or it's more in the hospital. Just so you know that it is a medication that has a pretty good duration of 1 to 2 hours. The dosage is 10 milligrams, either IM or IV. One thing that's important to note with all of these antiemetics is that they all have the potential to cause prolonged QT syndrome. Now, we don't expect you to know what prolonged QT syndrome is, but we do want you to know that it is a potential adverse effect of antiemetics. When we get into cardiology, we'll talk about that much, much more, and you'll understand that completely. But for right now, understand that one of the main concerns that we have about adverse effects of antiemetics is something called prolonged QT syndrome. The letters Q, the letter T syndrome. Prolonged QT syndrome. The next medication we're going to talk about is ondansetron. You might be more familiar with it as Zofran. Zofran is a very common medication. We give it out quite a bit on the ambulance for people that are having nausea. Uh, there is some old wives' tale of you give Zofran if they're nauseous, and you give Phenergan if they're actively vomiting. That's not accurate at all. That's kind of way things were back in the day, but there's no truth to that. Each medication has its benefit and its benefits and its adverse effects. It is a serotonin blocker, an antagonist, so therefore it will prevent and control nausea. It's good for patients that are pregnant. It is the preferred antiemetic for hyperemesis gravidarum, and that is excessive vomiting during pregnancy. One of the adverse effects is the prolonged QT syndrome as well. The normal adult dose is 4 milligrams, either IV, IM, orally, or sublingual. Your doctor can give you sublingual Zofran for if you have nausea, you can just pop it under your tongue and it will help alleviate that nausea. Takes a little while to work. Usually peak is about 2 hours. So that is Zofran. Remember, 4 milligrams. We will give that tons and tons on the ambulance. The next medication we're going to talk about is not necessarily an antiemetic, but it does have some antiemetic qualities, and that is diphenhydramine. Now, you've probably heard of this medication before. Some people call it diphenhydramine. That's not right. It's diphenhydramine. This is a medication you probably would give to your children to make them go to sleep at night. No, I'm teasing. I'm teasing. Don't do that. Don't do that. But it's Benadryl. If you have an allergic reaction, if you have allergies, a lot of times you will take Benadryl because it is a powerful antihistamine. It blocks the release of histamines, and it is an H1 receptor blocker. Okay, so remember that diphenhydramine is an H1 blocking antihistamine. Okay, and it is used for lots and lots of things. When you take Tylenol PM, it is Tylenol with diphenhydramine added, with the diphenhydramine added to make you tired. That's what that's all about. The Tylenol gets rid of your headache, and the diphenhydramine makes you sleepy. Now, the nice thing about diphenhydramine, we can give it to patients that are having severe allergic reactions or just normal allergic reactions. And it works well, and it potentiates with epinephrine. What do I mean by potentiate? Potentiate is when one medication or one substance makes another medication work better. So they work in conjunction to make each one a stronger medication, have a stronger reaction. Now, your book will tell you that the adult dose of diphenhydramine is 1 milligram per kilogram with a max dose of 50. Okay, and I want you to remember it that way. 1 milligram per kilogram, a max of 50. But pump the brakes on that 50 milligram dose. Most protocols will call for a dose of 25 milligrams. 25 milligrams will make your patient very, very sleepy. It does its thing, and it makes you very, very tired. The last thing you want to do is to give someone, especially an older patient, 50 milligrams of diphenhydramine, because you will knock them out. So pump the brakes on that. If you have someone who needs diphenhydramine, give them 25 milligrams, and then maybe if they need a subsequent dose, you'll give them another 25. But don't start out with a dose of 50. That's just too much, especially if you have an older woman who might weigh 100 pounds. You might even want to start at 12.5 because that medication has a strong sedative effect. And be careful with children also, because you can have a paradoxical reaction to diphenhydramine as well when you're younger. And what that means is it's the exact opposite of what you would expect. That's what a paradoxical reaction is. So you can have central nervous system excitement due to diphenhydramine with a pediatric patient. So we want to be careful with that too. We want to give just 1 to 2 milligrams per kilogram IV for them as well. I would lean towards 1 milligram more than the 2 milligrams. Pump the brakes on that one a little bit and take it easy, because it's a very powerful sedative and makes people very, very sleepy. Urticaria is known as hives. That's what you give it to yourself for. Like when you're home and you have hives and they itch, you'll give yourself Benadryl, and that will cause the itching to stop because it blocks that histamine release. The next one we're going to talk about is Compazine. Compazine is an antiemetic, and Compazine is the trade name. The generic name is prochlorperazine. Take that for what you will. It's that word right there on the screen. It is an antiemetic as well. This one is not in your book. Reglan is not listed in your book, but medical director wants you to learn it. The dose for Compazine is 5 to 10 milligrams given IV, and it lasts for 3 or 4 hours. The risk is prolonged QT syndrome again. The last medication we're going to talk about is Phenergan. Phenergan is the trade name for promethazine. Promethazine is carried on the ambulance quite a bit. Usually ambulances will carry ondansetron, which is Zofran, and Phenergan. Now, Phenergan is another medication that is an antiemetic, and it is an antihistamine medication as well, but mostly it is an antiemetic. One of the things that is different between it and Zofran is that it has a very strong sedative effect. It can make someone sleepy as well. So if you have someone that's vomiting and they're very upset and they're very excited, and you have to pick between a medication that will calm them down and a medication that won't calm them down, maybe you lean more towards the Phenergan versus the Zofran if all other things are considered as far as whether they're able to take it or not. But the dose is typically 12.5 to 25 milligrams given IV. And now that will need to be diluted. Typically, what I have seen in the past is the dose is 12.5 diluted given over a few minutes. But remember that it can make your patient sleepy as well. And sometimes we can take that side effect and use it to our advantage. If they're really upset, really excited, it will kind of de-escalate their excited state. It can also cause prolonged QT syndrome as well. Yep, so that's the medications for week 4 of the paramedic class. Like I said before, if you have any questions, give me a holler. We'll talk soon. Bye-bye.